In this video, we are going to discuss the reported blood clots from COVID-19 vaccines, which is in the news, and why these vaccines are still considered to be safe. Let's quickly try to understand the circulation in the human body and how these blood clots can form. So, human body has our heart and a system of pipes called arteries, which takes the fresh oxygenated blood to rest of the body. And then it also has a system of pipes called the veins, which bring the dirty or the deoxygenated blood back to the heart for cleanup. So usually blood is flowing very fast in these arteries and veins, so they do not clot. Also there are other mechanisms, but sometimes the blood can clot, and that can cause slowing down or a complete blockage of circulation of the blood, which can be life-threatening. So usual common place for blood clot is in the legs, causing leg swelling, but in the COVID-19 vaccine related blood clots, they are found in rare places, and I will discuss that in a few minutes. Two vaccines are associated with blood clots. One is AstraZeneca. Another one is Janssen's vaccine, also popularly known as Johnson & Johnson's vaccine. So the risk of AstraZeneca's vaccine blood clots is much lower. It is less than the general population risk, which means people can just get these blood clots without taking the vaccine at a much higher rate than if they had the vaccine. Doesn't mean there's a protective effect, but it does mean that the association between the blood clots and the vaccine is much weaker. So there is no clear-cut evidence that AstraZeneca vaccine is causing these blood clots. Of course, that's an area of concern. The Johnson & Johnson vaccine is known to have a risk now of blood clot happening in 1 out of every 300,000 people who take this vaccine. We should take this into perspective because this risk is considered to be still much lower than the risk of getting blood clots from other things. For example, the birth control pills. Birth control pills are taken all over the world. It has a known risk of giving blood clots to young people who take it. This risk is much higher. In fact, it's 200 times higher than the risk of blood clot from the vaccines. It is anywhere between 1 out of 1,200 women who are on birth control pills to 1 out of 3,500 women who are on birth control pills. So a much higher risk, and yet it is an accepted medicine in medical science, and people all over the world take it. So let's talk about this rare kind of blood clot that they are seeing in these patients. It is known as cavernous sinus thrombosis. Thrombosis is the medical lingo for blood clot, and cavernous sinus is basically the location where the blood clot happens. A quick diagram to show this to you. This is the human skull, and I'm drawing a human brain. The brain has arteries, and brain has veins to take the deoxygenated blood back to the heart. Now these veins, they pool in the base of the brain to make a bigger chamber, and this chamber is called the cavernous sinus. When blood clot happens in this cavernous sinus, that is what is called cavernous sinus thrombosis. Now cavernous sinus thrombosis symptoms are important to know. It can give you very severe headache. So it cannot be your run-of-the-mill a little headache here and there, but this headache is very severe. Sometimes it can cause nausea and vomiting. Sometimes it can cause vision problems. So it's a very severe headache. So just for a little headache, you do not have to worry about cavernous sinus thrombosis, but a persistent severe headache would be more indicative of cavernous sinus thrombosis. So severe headache, just not headache. That's the symptom. Now the other kind of blood clots that these vaccines are causing is splanchnic vein thrombosis, which basically is blood clot in liver, spleen, or intestines, and that can cause abdominal pain, severe abdominal pain, nausea, vomiting, blood in the stool, and also sometimes severe backache and back pain. So let's now discuss why we think these vaccines are still safe, or why the regulatory agencies are still considering these vaccines safe. There is a reason for that, so you can decide for yourself. The risk of blood clot from the vaccine is about 1 in 300,000 people. So 300,000 people take the vaccine, only one of them would develop the blood clot. 299,000 people would not develop the blood clot. They'll be just fine. Birth control pills taken all over the world, the risk is 200 times higher to get blood clots. 1 out of 1200 to 1 out of 3500. So if 3500 women take birth control pills, one of them would develop the blood clot. So if almost 300,000 women would take the birth control pills, 100 of them would develop the blood clot instead of 1 out of 300,000, which is the rate of blood clot for the vaccine. So this is just to get it in perspective that there are treatments in medical science which have much higher risk of blood clots, and yet they are accepted risks that we take. On the other hand, dying from COVID is 1 out of 33 to 1 out of 50. So 50 people get COVID, one of them would die, or 33 people get COVID, one of them would die, depending on which country you live in. That is the rate, 2 to 3% mortality rate for the COVID infection. So when thinking about these vaccines, we have to decide between these two. As you can see, the risk of getting blood clot from the vaccine is much lower than the risk of dying from COVID. So it's the risk and the benefit, that's how we make our decisions. Blood clots are a risk we are taking every day. We are going in long drives on car, we are flying more than 4 hours. Every time that we do that, we take the risk of getting a blood clot. So this is the risk and benefit, and I hope it helps you make a decision regarding taking the vaccine. Thank you for watching this video. We are going to try to bring more information. So if you do like this video, please like it. It does help us get more views so other people can get this information. Please share it with your friends and family so they also know it, as well as subscribe to our channel as we put out more videos.